Congratulations on your new hormone replacement therapy. Here at the UT Pride Clinic, it is very important for us to give you the best care possible. So we have made this step-by-step video to put you at more ease of how to help you with self-IM injections. Before we begin, let's go over some do's and don'ts for your therapy. Do wash your hands before beginning. Clean both your injection site and the vial with alcohol before puncturing. Make sure you draw up as your correct dose and take your medication as prescribed. Do not share a needle or reuse a needle. Do not stick the medication into your stomach, posterior arm. Do not draw back or aspirate blood after inserting the needle. Do not use any other testosterone therapies unless prescribed by your provider. Now let's look at the process for an IM injection.
Before you begin, clean your workspace area and wash your hands. You will need your testosterone vial, a 1 milliliter syringe, an 18 gauge fill needle, a 23 gauge injection needle, alcohol swabs, and an appropriate sharps disposal container. Keep in mind that you'll need to use a brand new needle every time. Not only does this keep you from getting an infection, it also hurts less. You are now ready to draw up your medication. To draw up, first you will need to scrub the vial hub with alcohol for 30 seconds. Then, connect your 1 milliliter syringe to the 18 gauge fill needle. This is the thicker of your two needles. Then draw back air into the syringe to your correct dose by making sure the end of the black stopper is at the appropriate marked line. This patient's dose is 50 milligrams of testosterone cypionate, so he will draw up 0.5 milliliters of medication. Grip your syringe like a pencil and uncap the needle in a fluid motion and puncture the vial. Then push the air in and flip the vial upside down and pull back the plunger to draw medication into the syringe. Make sure there are no air bubbles by tapping the syringe to get the air to the top, and then push and pull back until there is only medication in the syringe. You can draw back more medication and then push until you have your correct dose. Finally, recap your needle by scooping it up and securing it, then switch to your injection needle by twisting off the 18 gauge and twisting on your 23 gauge needle and set this aside. Now that you have all of your materials and your medication is drawn up, let's talk about where to inject. The safest and only recommended place for self-injection is the thigh. The easiest way to find the injection location is to stand up and note where your hand falls. It should fall in the upper third of your thigh, slightly toward the outer thigh. This is the appropriate place to inject. A pain reduction tip is to rotate sites between legs each week to give one leg a break. Now you have located your injection site. Sit down and wipe the area with an alcohol pad and leave the pad on your leg with the corner pointing to where you will be injecting. Another pain tip, make sure your leg is comfortable and relaxed. Injecting into a tense muscle is much more difficult than injecting into a relaxed one. You will then hold your filled syringe like a pencil in your dominant hand and uncap the needle in a fluid motion. Grip your leg muscle with your non-dominant hand and quickly puncture the skin at a 90-degree angle from the surface and move one hand to hold the syringe in place at the base and use your other hand to push the medication. Another tip, injecting quickly hurts less than going slow. Imagine the quickness and force you use to throw a dart and stick with confidence. You will then quickly remove the needle and apply pressure to the site with gauze or a bandage. Do not rub it. You will need to immediately dispose your used needle into your sharps container after you have injected it.
There are two options for disposing of your used sharps. The first one we recommend, and it involves buying one of the mail-in services that you can get from your local pharmacy or online through multiple services. The second option is outlined by the Texas Commission on Environmental Quality, and all the requirements say is that you dispose of your sharps in a thick, non-see-through plastic container, and that it is clearly labeled sharps and duct taped shut at the time of disposal. And then you can throw it away in your regular garbage.
Congratulations on taking the next step in your transition journey, and thank you for allowing the UT Health Pride Clinic to care for you.
UT Pride Clinic, it is very important for us to give you the best care possible. So we have made the step-by-step video. So you feel more. This is hard. Me. How to do it. So we have made this step-by-step video. Oh my gosh! I can't mumble. I'm mumbling. And then just go like this. Can you cover that up? That was
Quiet. Action.